heard a story this week and I thought, oh man, I got to make a video. I didn't have this one planned. I don't have time for this, but we're going to make time. So there are now, and I don't know why this surprises me. It shouldn't surprise me, shame on me for being surprised by this, but there are now large insurance brokerages, I should say, that are hiring individuals solely for the purpose of maximizing overrides that those brokerages can extract from health insurers and thereby driving up the premium to their clients. And it seems from what I've been able to gather that they're doing this on a percentage basis. In other words, hey, highfalutin consultant, come in, negotiate a higher level of overrides, and we'll give you a percentage of what you negotiate. And so, color me shocked, right? We're not bringing in high-level consultants to improve efficiency. We're not doing it to add value-added services for our clients. We're not doing it to show our clients how to put in free market health plans. No, 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 no. We are bringing in vultures. Is that too strong of a word? Maybe. To figure out how to farm the very most out of the system and extract as much premium as possible while disclosing as little as possible to you, the client. It's a good time. This might be one of my favorite memes I've ever created. Carriers discussing partnerships and not marketing plans every year. Me. So that's one of the things, clients, you don't know, employers, is that carriers like to approach brokerage offices and say, you don't need to go to market this year. They're new with us. They've only been with us a year or two, and we'll give you a very gentle renewal if you don't go to market. Good Lord. That's what a broker does, is goes to market. Are you kidding me? I mean, all right. I don't get sidetracked, but this video is going to be too dang long. Okay, so let's start with the basics. What is an override? Simply, it's additional pay to the brokerage for bringing a certain amount of volume, right? So if that brokerage brings a certain number of heads, bodies, lives to an insurance carrier, or a certain volume of premium, then oftentimes that insurance brokerage will get an override, a cash payment, an additional payment made to the brokerage from the insurance company that's not, quote, directly related to your premium. Therefore, it is almost never specifically disclosed on any of the documentation you see, 5500s, disclosures, all this stuff that you're seeing now with the CAA. It's almost never disclosed. In the CAA, you'll now see very highfalutin, lawyered up language that goes on for pages about how we may in fact receive overrides by placing this insurance business, but rest assured, it will not impact the way we decide to place business, right? Yeah, okay, good enough. Overrides can easily be 25% or more of a brokerage's total revenue. Huge, right? A quarter. So think about that. If you have a 250-person health plan, easily 25 grand of that can be an override going to your broker. Now, why does that matter? Well, I mean, I hate to have to spell out the simple stuff here, but if you've got 4 carriers in a local market and the brokerage has the most volume with carrier 1, right? Well, then the override is going to be potentially the most lucrative for the carrier at carrier 1. And if carrier 2 happens to be a better deal for you, that carrier might get poo-pooed in the sales process. They might make the spreadsheet, but there might be things that is said about how bad their service has been, how their network is shrinking. All of these subtle things that a broker can say to steer you toward the carrier that's going to pay their agency the most money. All right, so how do you ferret this out? How do you, as a consumer who, gets involved in renewals once a year for a few weeks, how do you figure out, who's most likely to be swayed by the override dragon, right? Well, let's start with this. There's a certain category of employer out there, insurance company, brokerage, hospital system, who have a fiduciary obligation to maximize the profit to their shareholders. Think about that. Does your brokerage have a fiduciary obligation to maximize their profit for their shareholders? Well, gosh, if that's the case, they'd be criminal not to seek the largest overrides they can get, right? I mean, that's what they're supposed to do. What kind of entities have a fiduciary obligation to maximize. Oh, publicly traded ones. Yeah, of course. Yeah. Anything to do with Wall Street. Huh. I wonder if I've ever had dealings on the insights of one of those. Oh yeah, I have. Anyway, that's a different story. So what about those brokerages that are now being purchased for the goal of stripping and flipping, as I like to call it? Yeah, that's private equity, right? So private equity comes in, they've got 2 to 5 years. They've got to strip this thing down to the bone. They've got to make the profitability look as large as possible in the short term so that they can say, hey, we're generating X revenue per employee. So they're going to cut out extra customer service. They're going to cut out extra tech advantages that you might have had with that brokerage. They're going to cut out anything and everything that might not perfectly fit in that Wall Street spreadsheet box of maximization of profit, because they're on a timeline. Not only do they have to maximize profit, they got to strip it and flip it right now, right? They got 2 to 4 years. So when you look at these brokerages that are getting gobbled up, and not just brokerages, by the way, PBMs, hospital chains, insurance companies, when private equity comes in, do you think that they are motivated by the extra profits that they can extract from the carrier community by negotiating overrides? Now, again, the override doesn't directly affect your premium immediately in year one, but think about it. If the carrier is paying this much more money to the brokerage, of course it affects your premium globally on the macro sense. And of course, do you really want your broker steering you? And again, steering's a strong word, but incentivized to steer you to one carrier or another based upon how much money he or she can make? Doesn't sound like a very good idea, does it? Okay, what else? So I think there's 3 ways, right? You get Wall Street, private equity, and then what else? The larger the brokerage, right? The largest brokerages have the most incentive to steer. Why? Because it's all done on volume. I've recently relocated to the wonderful folks at the Mahoney Group. 200 employees, no private equity, no Wall Street. It's an ESOP. It's an employee-owned organization. We do what's right every time, no matter what. That's our goal. We get virtually no override. In fact, I don't think we get any overrides. It's because we're just not big enough, right? So small independent brokers aren't getting overrides, okay? The larger the brokerage, the more the overrides. It's just a fact. It's just a law of large numbers. Okay, so who are the largest brokers? Well, lucky darn, they publish a list of these every year. So here's a list, the largest brokerages. Now, I'm not here to say every one of these is steering based upon overrides. Of course they're not. I mean, you know, never mind the fact that, Elliot Spitzer came after the 1 or 2 of these brokerages for steering back in the day, and they swear they never do it anymore. But the bottom line is, with this kind of volume, you get steerage because you get massive overrides. It's just, now, you may not. You may have a fantastic broker. You may have the best broker in the history of the world, and they may work at one of these giant houses. That's fine, but that broker, that individual broker, is getting pressure one way or another from the management team. And it could be very subtle. It could be how the messaging within that brokerage is, positions one carrier versus another. And the marketing material they share with the brokers regarding the carriers. It can be very insidious, folks. Trust me. I've done this for a lot of years. I'm an attorney who looks under every rock and in every nuance, and I've seen it. Bottom line is, I've seen it. It makes me want to vomit, and I will never work at one of these houses again. It's that simple. I will either be independent and free, or I will retire. Just not going to do it. So this kid pops up all over the interwebs. I don't know what his deal is, but I got to tell you, he is one wise little dude, right? So he's learning a little bit about the insurance industry, from this fine lady, and he says, so you're telling me their fiduciary obligation is to maximize profits for shareholders. They control 80% of the delivery system. They're able to hide fees in every nook and cranny while developing the largest employment lobby in the United States and sending countless millions to Congress annually. And your fiduciary obligation, employer, is to keep healthcare costs as low as possible with an HR person and a CFO that do this once a year for a couple weeks. Good luck with that. I'll see you at renewal.